project is on the insulin pump. Okay, so our motivation, currently 25.8 million people suffer from diabetes in the US alone. The number keeps rising each and every year. And diabetes is the leading cause of kidney failure, non-traumatic amputations, and also new cases of blindness among adults. And so overall, there's a need for higher glucose control. So why does the insulin pump exist? Well, there's pretty much three motifs to the insulin pump. There's control, there's precision, and there's independence. In the sense, there's control in the sense that if you don't have the insulin pump as a diabetic, you have to take a long-acting insulin called Lantus, which lasts 24 hours in your system, and you don't control the hourly rate of insulin in your body. Whereas an insulin pump, there's no need for a long-acting insulin, only short-acting, and you get to control the amount of insulin given to you per hour. The rate of insulin is called the basal rate. And also there's a short-acting insulin, as I mentioned before, which you give yourself for meals and if you have high blood sugar, correct it. So in a sense, there's more control. And there's precision in the sense that when you take insulin injections, they're in units of 1 unit, 2 unit, 3 units. But in the insulin pump, you can control up to increments of 0.025 units, so more precision, as I mentioned earlier. And also, there's independence or freedom in the sense that you don't have to walk around with insulin syringes with you all day whenever you have high blood sugar to take insulin shots. Also, when you want to take a meal, all you have to do is just dial it in there. And this is the statistical data. As you can see by this chart, A1C is the 3-month average of your blood sugar values, and typically A1C should be for a diabetic around 6. And here a study was shown where before and after insulin pump trials, there was a 95% confidence level study, and sample population 95 patients with type 1 diabetes was used. And as you can see, before the pump, the average A1C value was around 8.1, and after the pump, it was around 7.7. Now, I know that doesn't seem significant at first, but for every percent drop in A1C values, A1C levels, there's a 10% drop in likelihood of complications due to diabetes.
Basically, the insulin pump can be divided largely by 3 parts: the control processing part, the delivery part, and the injection part. The first part has a pumping mechanism, power supplies, and display. The delivery part has the insulin reservoirs and tube, and the injection part is middle. Usually the insulin pump is stored outside of the body, and there's an infusion set that help the tube passing through the skin and passing through the skin and resting the fatty tissue, so the insulin goes to the interstitial space. This is the diagram of the insulin pump. Basically, the insulin pump is designed to give the constant flow of insulin. So the flow can be adjusted, and there are 2 types of insulin infusion: the liver and the bolus. The liver infusion means a small amount of dosage, and it's a constant flow of insulin. And the bolus injection means a relatively large amount of insulin in a short time, so it needs when we take the food, intake the food. So the flow rate can be sensed by the strain gauge, and on the monitor there's some important information about the insulin infusion. Also, there is an alarm system, as Dr. Park said in class. The sound system is useful to the medical device. So if there's a problem about if there is not enough insulin, if there is not enough insulin, it can alert the patient. This is how to use insulin pump effectively. The manufacturer recommends the patient to change their infusion set regularly because of the infection problem. Also, patients should change their infusion site because of skin damage. And if you use the same infusion site for a long time, it can cause it becomes more difficult to control your blood glucose level.
So now we're going to compare the insulin pump to the gold standard. There's no real gold standard for the insulin pump yet, so we will be comparing it to the actual insulin and blood glucose regulation in the body. So in the body you have insulin, which is produced by beta cells. You have glucagon, which is produced by alpha cells, and both glucagon and insulin counterbalance each other and work to maintain a constant blood glucose level in the body. So this means that when insulin is working, for example, glucagon is not, and when glucagon is working, insulin is not, and this is how it's regulated in the body. So when you have an insulin pump, you would need to have injections that are timed around meal times, since glucagon works in between meal times and insulin works while you're eating. So this is where we have the bolus equation. We also have the insulin pump that needs to monitor blood glucose levels. So here the meter does that and adjusts them accordingly. The insulin pump will also need to keep the blood glucose level from fluctuating too much and maintain that maintain the insulin and glucagon levels in the body. So here we have advantages and disadvantages of the insulin pump, which is characterized by continuous subcutaneous insulin diffusion. So advantages of the insulin pump are that it produces glycemic control, it reduces the amount of hypoglycemia, you have lifestyle flexibility, etc. And we also have disadvantages of the insulin pump, which include cost, weight gain, hypoglycemia, psychological implications, etc. And comparing the insulin pump to daily injections of insulin, injections are used mainly for younger patients, whereas the insulin pump can be found more among older patients. You have a lower blood glucose level in the insulin pump than with the daily injections. You also have more glycemic control in the insulin pump compared to daily injections, etc.
Okay, so there are many different types of insulin pumps. One of them that we just talked about was the regular insulin pump, where it's like a pager and it clips onto like your belt or like anywhere. There's a cartridge for an insulin to go into the pump, and what it does is it is attached to a catheter, which is attached into your abdomen, and it pumps insulin into your body, except for it needs to be replaced every 2 to 3 days. Another one is the tubeless insulin pump, where there's a pod and it attaches onto your body, and there's a needle that goes inside your body, and it sends messages to the personal diabetes manager, where it can calculate the insulin dose needed, and then the insulin can be injected into the body by the pod. Another one is the implanted insulin pump, and it is a there's a sensor implanted underneath the skin, and what it does is it senses the glucose levels, and it calculates the amount of insulin required. And there's a underneath the skin, there's the insulin that's in a compartment, and it allows the body to uptake the insulin. And but every 2 to 3 months, you would have to replace it by injecting insulin by a needle through the skin. So improvements that we could do to make the insulin pump better would be a better way to measure glucose without having to like stick yourself with a non-invasive way. MIT has done something similar. They've made an infrared signal to measure the blood glucose levels, but it's not accurate because it can only measure so far into the skin, so we would need to find something to measure deeper. Also, wireless communication to a cellular device. We could have a device that monitors glucose regularity in the body and then sends signals to your cell phone to tell you when you need insulin injections. Also, like a patch for insulin to diffuse into the body. They have this already, but it's not as effective, the diffusion of the insulin. So we could make a patch that's more permeable, more permeable to insulin by like heat activation or fluorescence. Any questions?
Like 30 seconds for questions.
I had like a quick demonstration.
Okay, see it.
Should I do it?
Yeah.
Okay. We don't actually have a video, so I want to show you guys how you could actually even take insulin without even looking at your device. There's a wireless remote, as you can see right here. You just press it once, and it beeps to show that it's activated. Then you press another button, the bolus button, which beeps one more time, which shows 1 unit of insulin. Each beep is a 1 unit increment. Another 2 units, 3 units. And if I want to cancel the insulin, the process of injecting myself with insulin, I could just press S right here, and it alerts me. So there's an audio alert. And also, if you run out of insulin, it starts vibrating and beeping. It vibrates in case you're asleep and wakes you up. That's what actually happened to me this morning.